I'm Major Beena, GM Nursing, KIMS Health, Trivandrum. I would say these are pan-India. It is not in one place, one state or in one organization. It is across India, it is same when you compare to the Western world or the European world. At organization level, first and foremost, definitely it is the pay scale. When you compare to the European world, the pay that the Indian nurses receive is very meager, I would say. And now the things are changing. The government is looking at it, changing the pay scale, changing the scenario, and maybe it will come up in a better way. Also, it is not only the pay. So, a motivation for every nurse to work is to have a positive culture or a good working environment or a healthcare ecosystem. I would say that is lacking in India. That is the most important challenge that the nursing fraternity face as of today. Like the cadre, the promotion cadre and the structure, when you compare to European countries, it is nil, we can say here. Most of the nurses, they stay as a registered nurses even when they are at the age of 50 or even after 20 years of service. So there is no ladder or a career pathways for nurses in India. Where are other countries? They lead many areas. There are countries where the nurses lead the organization. They run the administration. Here it is not a lack or dearth of capabilities or skills or abilities in nursing. They are multitaskers. So train them, they can be the best administrators or rulers of the hospital or any healthcare system. But in India, we really don't consider that. So definitely it is very demotivating to the nurses. So that is another thing. And no practice laws. When you compare European countries, they have nurse practitioners. They can practice independently. There is no such law that guide nursing in India so that they can practice as nurse practitioners or nurse-led clinics which are available in European countries. And many of the organizations and in India as such, there is no retention strategies implemented at organization level also for nurses so that they stay back here. We are finding a very big brain drain as of now. Though 158,000 nurses are trained coming out of our institution, around 50% is migrating to other countries. And globally, almost 2 million nurses are short, will be short by the end of 2030. Mushrooming of nursing colleges or in educational institutions leading to unchecked production of incompetent manpower pool into nursing. So this happens because they don't have experienced and qualified faculties, enough faculties or infrastructures or facilities to give them hands-on training or to update their skills. And many of the places, not even a hospital is attached. So the students go to some medical colleges or some kind of a government system where no one, they are not monitored by anybody. They are not given a chance to practice anything on their in the patients. So these kinds of, but when they come out, they'll be as a graduate nurse. And also here, once they come out, pass the exam and come out, the license is issued to them. License means it is a permit to practice nursing competently. But the competency is not checked unlike other countries. In states, even if you pass exam, you come out as a graduate, you need to take a licensing exam. That is NCLEX RN it is called. So that is that test exam, check your critical thinking, check your competencies, check your outcome. How can you practice the thing that you learned? The applicability is checked during this exam. Once you clear this NCLEX exam, then only license is issued. There, the safety of patient is ensured by having this selective competent nurses. Simply not passing will not make a nurse. In Kerala, our selection process is very stringent. The selection for nursing colleges happens through entrance exam that is called NEET, the same entrance that is for medicine. And those who get through this entrance exam will be definitely in a very good academic track, having good academic track record. That is, maybe most of them scoring more than 90% of mark in +2. And also our regulatory bodies like councils are very stringent with the rules and regulations of the institutions with regards to the faculties. So every colleges in Kerala has qualified and experienced faculties, and they definitely follow the curriculum properly and taught to them. And most of the colleges have best of the best facilities and infrastructure, including skill labs to upskill them. And also no colleges in Kerala are without a parent hospital. Every nursing colleges is attached to a minimum 200 bedded hospital along with that, so that they send their students for practice, and assignments and everything is done meticulously, and exam and all other things. So once they come out of the college, they are in any case much higher and better compared to other states students. So that is why Kerala nurses are always in demand. In KIMS we have a very robust onboarding system for newcomers. Onboarding system comprises of classroom trainings, skill lab trainings from 15 to 30 days. After the onboarding, we have a robust preceptorship program or a buddy system. Each new nurse is given a buddy or a preceptor for 3 months, and that new nurse practices under this buddy or a preceptor, so that she can adapt easily to our culture and system without getting stressed out or without getting any burnout. Another thing in KIMS is we have a lot of career opportunities or a ladder or career pathways. So we give promotions and career changes as from a staff to GM level or AGM. So we have different levels: supervisors, managers, AGM. And also, as an example, in KIMS, 2 nurses are now in operations. Our quality is led by, basically she was a nurse. Even in operation, general operation, there is a nurse, AGM, she is working. So such kind of career opportunities and cadre structure is available in KIMS. And other thing is external support system or peer support system. For that, we are launching a program called Mitra. The name is Mitra. So that is nothing but our senior nurses of 8 of them who are chosen by the staff, the most approachable one, and they are trained in counseling, communicating, listening and things like that by our psychologists and other faculties. And they are given a number, and one person 24 hours holding this number. Any nurse having any problem, personal or professional, they can approach, they can call 24/7, and each one will be taking duty shift wise. So that is something that we have launched, we started in our institution, so that the nurses feel supported or helped when they are in need. So that will definitely reduce their stress and burnout, and there is a place for them to vent out and to get help in the time of need and at the time of requirement. We have structured specialty nurses. That is what I say, unlike any other places, hospitals, we have nurse-led clinics in our hospitals. The nurses are very much empowered here, like thyroid clinic, liver function clinic, heart failure clinic, vaccination, adult vaccination clinic is led by nurses here. And this is one place nurses are very much empowered. That is what is lacking everywhere in other places. Here we have a DNO system. DNO means duty nursing officer. Over 24 hours we have DNOs on duty, and they are empowered to take any kind of decision, starting from taking admission to stopping discharges, going against DAMA, arranging beds, taking referrals, all that. And they have access to the top management at any part of the day or night, and they are empowered to do that. So empowerment is something that keeps the nurses or help the nurses to retain here.